I'm Alex Morash, and let's queer up the USA View. Non-binary doctor sues New York City hospital alleging bias, misgendering, and pressure to hide identity. A non-binary doctor has filed a federal lawsuit against New York City Health Plus hospitals, alleging workplace discrimination and pressure to hide their identity. Danielle Peterson, a former dermatology resident, claims they were told not to tell anyone about being non-binary when they began the program. The lawsuit outlines what Peterson describes as a hostile work environment, including repeated misgendering, derogatory remarks about trans and non-binary people, and senior staff questioning their identity and appearance. It also alleges Peterson was told there was, quote, something mentally wrong, unquote, with them, and was pressured to undergo a psychiatric evaluation or risk losing their position. Two independent evaluators later cleared Peterson for work. However, Peterson says they were still removed from clinical duties and their contract was ultimately not renewed. According to the lawsuit, the non-renewal came months after Peterson filed a formal discrimination complaint. New York City hospitals and Health has not responded publicly. No determination has been made, and Peterson has requested a jury trial. Well, first and foremost, unfortunately, this sort of discrimination in the workplace is way too common for LGBTQ people, but also, it's way more. Discrimination and bigotry within the medical community is actually really rampant. Whether you're talking about how queer people, and all of us as queers can probably tell stories about doctors that have been inappropriate. Also, there's been studies on how doctors don't believe black pain as much as they believe white pain, which is just mind-boggling to me to read about. That's before we get even to the history of what the medical community has done to non-white people. Don't Google black men medical community and syphilis, for the love of God. And then to hear this story, I can't say I'm shocked that the medical community has acted this way.
Well, as a professional mediator and person who resolve problems, this is a symptom, or rather, this is a problem for these hospitals or large organizations when you keep shunting down PR problems down the road. And of course this person is victimized because of their identity was basically ignored, and their complaints are probably generally overlooked because of power imbalances. Maybe the person who making the allegations was in a more powerful position. The fact that they force them to undergo psychiatric evaluation speaks a lot, because that means that they're trying to basically find a reason, and probably ordered by someone higher up in the organization, in order to justify their removal.
That's called institutional bias. That's not a PR problem. That's a clear bigotry.
It's a conflict resolution problem. It's not a PR problem.
Well, it's shocking to hear this. Being in HR for my day job for over 20 years. You kind of wonder really what the third side of the story is. And one of the things I'm curious about, and I'll investigate further on my own, is, the way it was handled, especially in New York. You think of New York City being by the book. I worked in HR in a suburb of New York City in New Jersey, and several organizations, including healthcare organizations, were always sensitive, especially if we had a location in the city, because that would take precedence potentially in a litigation situation. So, it's terrible that somebody who's going through a residency was basically, it sounds like, forced out of the program. It sounds like there was some harassment that was initiated, and that there was nothing done to address it with the parties involved. Yeah.
So medical mistrust is a large component of conversation that I have within my family's organization called Shaq's Hope Foundation. My sister was born with sickle cell anemia, passed away 10 years ago. And before she passed away, she created the nonprofit. And growing up, I remember going to the hospital with her, and they didn't believe that the people living with sickle cell were in pain and that they were addicts. So talking about bias and stigma is a large part of the conversations we have. So it doesn't surprise me that the LGBTQ community in the medical settings are dealing with discrimination. There's a large history of that.
Yeah, and to question one's mental health, as in this case, or what you're discussing as well, it's a big concern.
It also pushes professional trajectories of entire communities.
Yes.
There's no surprise that the LGBTQ community and minorities tend to actually become solo entrepreneurs, or people who are work by themselves by themselves because they do not want to belong to an institution or organization that potentially can inflict them with damage based on bias.
But like with healthcare, it's so dangerous when they act like this. Because yes, this is like the not being able to trust the medical community is very real. But there's also like sometimes we need to kind of trust the medical community. It's this awful push and pull. Because like, don't listen to guys like Robert Kennedy Jr. and Trump saying to put bleach in yourself. Don't do it. But like, if the doctors aren't going to believe us and listen, like, what are we supposed to do? Like,
the distinguishing part is that RFK Jr. nor the other guy is any kind of medical professional. The fact that we have we have an HHS secretary who does not believe in basic scientific tenets is concerning enough.
Well, we're all hoping that the blue tide comes along in November. There is no other queer nonprofit media program like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.